Hey everybody, I'm back. This is Elisa. We're talking about the male reproductive system, and this time we're going to go through part three, descent of the testes and scrotum formation. There we go. So we had previously been talking about the development during fetus. So I kind of wanted to go through it a little bit more detail. So the 3-month fetus, very, very teeny tiny, begins to have like a small protrusion, sometimes detectable on ultrasound, sometimes not detectable very well. As you can see, what ends up happening is we start kind of like having this little swelling here. This is the scrotal swelling. It used to be labia majora in females, but since we have that X and that Y in this individual, it's going to become the scrotum. And so it's going to emerge and continue and actually form this like housing, right? And so this housing is going to eventually kind of pull it, or the testes are going to drop into it, and we're going to be able to kind of modulate their position like closer to the body or further away from the body. Right, so let's go through a couple of the items that we're looking at here. It's the vaginal process is actually what we're kind of like looking at, this going all the way through, and then it closes up, becoming the tunica vaginalis. As you can see, we have now hosted safely the testes right here in the 1-month-old infant. Um, let's see, vernaculum is going to be that connective tissue that's going to be pulling and seating that testes right into the little um, cradle of the scrotum itself. Spermatic cords are also going to follow, as well as blood supply, nervous supply, and all of the duct system. Um, right. There are also muscles that we'll talk about a little bit later that are going to kind of enable the individual to augment the position of those testes. So I just kind of wanted to show that. Right. Pretty good. Pretty good. Okay. So things we're going to look at: anatomy of scrotum, testes, penis. We're going to talk about later on. We need to follow a sperm cell as it forms and becomes a baby sperm into a grown sperm. Follow it through ejaculation, and we need to look at all the different like duct systems and passages as it travels, as well as it matures, like what it does there. We'll look at all the names, locations, and functions of the male accessory reproductive glands, which are super important for semen production. Okay, male reproductive anatomy. This is the cutaway here. So most of these we've started talking about, but we were talking about in developing fetus. And so let's go ahead and just go top to bottom. Urinary bladder sits up here on the top. It actually sits on top of, you guessed it, right here, the prostate. As you can see, the urethra actually goes right through the prostate, and so it's super duper important just to keep that monitored for swelling, for cancer, as individuals age. It can be super common, very, very painful, and actually very dangerous as well. So you can see that pathway can actually close up as that prostate swells, so keep an eye on that. The root of the penis is the component that's still kind of inside the body and introducing it to the outside of the body. The penis actually elongates, right? So it has become elongated with an elongated urethra as well. Um, it is known as the shaft of the penis, so this is like the outer part, the outer part as well. The head of the penis is still down here at the end, right where the clitoris would be in females. Still has a ton of sensitivity. Most of that sensitivity you should know is reflex, right? So any kind of like brushing motion, temperature sensitivities or change, anything can actually stimulate a penis right away. So that is not always a conscious act. So let's see here. Root of the penis, ductus, and the vas deferens, right? So like the main superhighway from the testes all the way back into where we start going to meet up with some of the semen producing elements of the male reproductive tract. So vas deferens, ductus deferens. Think of it like vast, like, oh, it's vast. It's very like long tract. It's the vast journey from the testes, I guess, would be the best way to think of it, right? Okay, the shaft of the penis we talked about. Okay, corpus cavernosum and corpus spongiosum. So these are going to be connective tissues, as well as tissues that are going to be supportive or hosting large blood supplies, lymphatic supplies, as well as kind of protecting up the nerve supplies. We'll see it on like a different cutaway that's a little bit easier to kind of follow. So going back to the vas deferens and the vast like journey of the sperm, what hugs up right next to the testes is going to be what we call the epididymis. And it's not quite the same, but it's kind of like a last checkpoint before we run into the vas deferens, before the sperm has moved into it. Let's see here, glands of the penis, right up here at the head of the penis. Precipice, this is the frontal, most anterior component. Testes itself, right here in the scrotum. Okay. So rectum is directly posterior to the male reproductive tract, but it kind of like, oops, it kind of actually is very thin, so it goes like right up against it, right? So individuals that are experiencing things like issues with, again, prostate or issues with the colon in general might kind of have like synergistic effects on these two systems. So something to kind of keep aware of. The ampulla of the ductus deferens is like a large area right here, a broadening of the vas deferens itself right before it kind of meets up with all the accessory organs. Seminal vesicle itself producing some semen needed for ejaculation. The ejaculatory duct is actually starting to process some of that um, semen directly into the urethra. And the prostate itself, as we know, is one of the other accessory glands, which we'll look at. Also, some more of the fluids, the bulbourethral gland, um, and the bulbospongiosus muscle is going to be right here, and we'll talk a little bit about its um, function as a skeletal muscle a little bit later on. Okay, and then the urethra, right, is going to be this passage here. So it's going to be coming from the bladder, but it also temporarily hosts sperm during ejaculation, right? And then some trickles of the ejaculatory fluid just kind of help keeping that urethra clean, right, and maintenance pH, right? The external genitals of the male, the genitalia of the male, is known as the scrotum as well as the penis, because it's on the outside and it's external. There's a lot going on. And they occupy the perineum, which is right between the thighs. So we talked about that. So it's like at the bottom of the torso. Here's my person. Hello. Right down here, right at the bottom. It's bordered by the pubic symphysis and the ischial tuberosities and coccyx of the skeleton. Here's what we see here. So there is this perineal raphe, and so that's kind of, it's like almost like the suture that kind of closes up between all of the scrotum as well as all the way down to the anus. And so that's um, right, that's it. This is the male perineum. It's the urogenital triangle, right? So ural genital triangle right here. Anal triangle right here. Okay. Scrotum is a pouch of skin, muscle, fibrous connective tissue containing the testes, right? So there's a lot of business. Very lots and lots of quite frankly, items for us to go through. The left testicle usually descends a little bit lower than right. So there is not perfect symmetry. It's the same as in many things in the body. Humans are never really perfectly symmetrical, but in this case, the left testicle is going to typically descend a little bit lower than the right. It's nice because it means that they don't compress against each other too much. They're just like offset enough, right? The skin has sebaceous, and so they're going to be on the oily side. Sparse hair, but it is there, and it is relatively coarse. Rich sensory innervation, dark pigmentation, which is similar in the female as well. Internal median septum divides the scrotum into the right and left compartments. So it's not entirely divided, but it's like relatively divided. Like, I guess, how would you say? Maybe not like plaster walls divided, but more like cubicle divisions, right? We'll look at that in a little bit. Perineal raphe, medial seam, like a literal seam on the outside of the surface, and it marks The location of the septum, which is of course like that which is going to separate items, extends anteriorly along the ventral side of the penis and posteriorly all the way to the anus where it terminates. The spermatic cord is important. It is a bundle of lots of connective tissues. It's going to contain that all important ductus deferens. That ductus, or I'm sorry, the spermatic cord is also going to help with the bundling of the blood lymphatic vessels. And of course, the testicular nerve, it's going to continue all the way through the inguinal canal into the pelvic cavity. The external inguinal ring is going to be the inferior entrance to the inguinal canal, and the internal inguinal ring is the superior, right? So it's the top exit to the pelvic cavity. The human testes reside in the and it's mainly because sperm kind of needs to be produced a little bit cooler temperature. So if we're sitting at like 30 degrees Celsius for a general body temperature, we just like sperm needs it a little bit cooler, so like 35. The scrotum has three mechanisms to regulate the temperature of the testes. One is this awesome muscle, awesome cremaster, little strips of this internal abdominal oblique muscle that are going to be around the spermatic cord, just really evolutionarily quite the coolest thing. And like basically what happens is it allows a response to temperature. So cold temperatures, it actually pulls the testes up towards the body to protect and warm them, right? Maintaining that all important sperm temperature. But in the warmer temperatures, when it's really hot, it actually kind of relaxes, allowing them to suspend and fall farther away from the body and just like lose some of that heat, hopefully, is what's happening. The dartos fascia, subcutaneous layer containing what we call the dartos muscle. So this is different. So this is a smooth muscle and it contracts when it's cold, and it actually causes a wrinkling of the scrotum, and it helps kind of keep the testes warm against the body, and it reduces the area of the scrotum, which is what's really important. It kind of thickens it too, and that further is going to just slightly, at least slightly, insulate it against heat loss. So scrotum is so busy, super busy. Cremaster, check this out. Cremaster, external oblique muscles, right? Just look at that all the way around, pulling in and out. So that's a really cool thing, I think. Anywho, let's go through it. So ureters are up here. The urinary bladder is kind of this like little horizon that we're seeing in the back. Right underneath it would be like where the prostate is, for example, and then all of the accessory organs that are going to help make all of these secretions for semen. The testicular vein is going to kind of like do this interesting thing where it meets with this testicular artery, as you can see over here, and they start coming out and making this like web shape, really. So they kind of open up, and what we refer to that is like the pathiniform plexus, right? It's a plexigy, meaning it's a complex, right? So that's what that's referring to. Let's see, let's get back up here. Oh, ductus deferens, right? So we are leading sperm away from the testes, going out for ejaculation. Spermatic cord, when it is opened, is all of the stuff in there, like all of the blood vessels and the nerves and all of these components that are going to be supportive to sperm production and protection. We talked about the piniform, ductus deferens down here as well, leading away, right, from the testes. Tunica vaginalis, right here, is going to be kind of surrounding the testes here. Epididymis itself, which we'll look at further, is going to be hugging just part of the testes, collecting that nascent sperm, helping it develop. The testes proper is going to be situated right here where all of the business and protection is covering. The scrotum itself right on the outside, so that's labia majora, right? Perineal raphe, so that's that little seam we talked about, kind of dividing. As you can see, it's not like a total division, so you can have to kind of watch out that there's not too many issues with interconnections between these two. Dartos fascia is going to be right underneath the scrotum itself. We talked about cremaster, awesome cremaster. The fascia of the spermatic cord itself is connective tissue fascia, right? So the spermatic cord again up here, coming down to support, envelop, and wrap, and mobilize in some cases the testes. A superficial inguinal ring Right up here, when we're leaving actually the skeleton component, the inguinal itself and the inguinal ligament, which is going to be like right here supporting, adding to these structures. Let's see what else. Oh, penis proper, right? External copulatory organ right here. And the head of the penis, shaft of the penis, right through here. Okay. So mechanisms to regulate the temperature of the testes. There's a lot. Papilliform plexus, we saw that the blood supply is going to kind of make this net in a way of the veins from the testes and surrounding the testicular artery and the spermatic cord itself. And so what that does is like it allows there to be this like blood supply kind of rushing over it at all times. So what would happen is if we didn't have this like plexagy formation where it was kind of interlacing and it turned into that lattice, the artery blood is so hot. It's like it's warmer. Okay, it's physically warmer. And what would happen is it would actually warm up the blood so much just around the testes that it would make it so the sperms can't properly form. So we need that. So this was kind of an ingenious way to overcome that hurdle. It removes these heats from the descending arterial blood. These heats, that's, sorry, heat units, I guess. Removes heat from the descending arterial blood. I'll get a cup of coffee in a minute, guys. Sorry, everyone. By the time it reaches the testes, the blood like down. I mean, we're talking centigrade, like 1.5 to 2.5 centigrade cooler. So that's like Celsius. That's not small. That's pretty quick. Okay. So we're going to get into this a lot more. We're talking about sperm production. We'll talk about all these really cool features and parts and evolutionary components. But in the meantime, I hope you enjoyed that. I hope you learned something cool and valuable, and I hope you have a wonderful day. Bye. Bye-bye.